Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be discussing with you about a treatment plan for the condition chronic bronchitis. Okay, by definition, chronic bronchitis is a condition that results in the production of purulent sputum for at least 3 months in a row over 2 consecutive years. Okay, sputum is more common in males and individuals over 40 years of age. Okay, between 10 and 25% of adults are affected with the disease. Okay, so causes: one is smoking, which result in airway inflammation that is thought to trigger the specific pathological changes seen in the airway, goblet cells, and epithelium. Okay, so these are goblet cells, and epithelial cells in where the airway is. Okay, in the airway location. Okay, the environmental factors, including air pollution and occupational exposure to inhaled particles or fumes. Okay, so these are the causes of chronic bronchitis. For the symptoms, there's an increase in mucus production from the bronchial glands pertaining to the bronchi, okay, the glands. The airways narrow due to chronic inflammation. So it's, the inflammation has been there for a long time, chronic. Thickening of the bronchial airways and accumulated mucus. These guys about mucus, okay? There is a decreased mobility of the thoracic joints pertaining to the thorax joints, the where located by the posterior rib cage area. Okay, the rib cage area, thorax, first posterior and anterior rib cage area. Okay, respiratory infections may be present pertaining to the infection in our respiratory tract. Okay, the going towards the lungs. Okay, the respiratory tracts. Okay, a chronic productive cough is present. Productive cough. Okay, which is chronic. So productive cough, guys, is a cough that produces mucus or phlegm or sputum. Okay, so this is a chronic cough which worsens in the morning and evening and in the winter months. Okay, it's worsening on these months, or in the morning or during evening time. Okay, so winter months, morning time and evening time. The cough begins slowly, worsening over weeks or months until it is productive and the mucus is purulent. Okay, a purulent mucus is containing pus, which is usually yellow or green in color. It's a mucus, okay, with a pus. Okay, over time, cyanosis, which is bluish discoloration to hands or feet, occurred due to hypoxemia, which is low level of oxygen in the blood. The finger ends are globed or bulbous. Okay, dysfunction, malfunctioned or dysfunctioned. The finger ends is not in normal condition. Okay, there's abnormality on the finger ends. The person tends to retain weight. Okay, and peripheral edema, so swelling on the peripheral means on the ends, towards the ends of like the limbs. Okay, like the finger area, results from venous stasis, blood coagulation, and right-sided heart failure. Okay, let's move on to part 2, subjective component. In this level, we're going to be asking health history questions. So these are some of the questions. When was the onset of the chronic bronchitis? Can I ask this question, guys? Has it been diagnosed by a physician? Okay. Does the client have any other respiratory conditions such as emphysema or asthma, or cardiac conditions such as right-sided heart failure? Okay, it's important to ask your client. What is the client's occupation and recreational activities? It's important. Does the client smoke? If yes, how much and how frequent? Does the client know which lobe is affected? So our lungs has two lobes, the left lobe and the right lobe. So you're gonna ask the client which lobe in the lungs is affected. Okay, and does the client have dyspnea or dyspnea, which means shortness of breath? Okay, so you're gonna ask your client, is the client's sleep interrupted by breathlessness? Okay, is the cough productive? I already explained a productive cough a while ago. Is it severe? Okay, what time of day or year is the cough worse? I mentioned it is worsening in the morning or in the evening or during winter times. Okay, so you're gonna ask your client to know this. Okay, what is the color of this sputum? Okay, I mentioned if it's productive, the sputum is yellow or green, and that's when you detect that the sputum has a pus. Okay, so you can ask your client, is it severe? What is the quantity of the sputum? Okay, quantity, how much sputum does the client expel when the client coughs? Okay, has the client ever been hospitalized for chronic bronchitis? Okay, when and for how long? Does the client have a fever now? So it's important to ask the client at the time of the appointment if the client has fever. If so, mass the client taking any medication? Sorry. Has the client taking any medications? You're gonna ask this question as well. It's very important. How often or how frequently? Is the client taking other parallel therapies such as physiotherapy? Okay, you're gonna ask the client this. Okay, so let's move on to part 3, which is the objective component. In this level, you're gonna be assessing the client. So you're gonna do assessment. One of the assessment is observation. So in the observation level, you're gonna do the seated client may lean forward, stabilizing the shoulder girdle to assist with inhalation. Okay, so this is one way of your observation. The accessory muscles of respiration are likely hypertrophied. Okay, there's abnormality on this area. There may be dyspnea, which is absence of oxygen, difficulty in breathing, or tachypnea, which is rapid shallow breathing. The breathing pattern may be apical, using the upper chest only. Okay, that means apical. A barrel chest, which is increased anterior, posterior, on the posterior side. Thoracic dimensions, thorax meaning the rib cage area, may be present. Okay, barrel chest, you're gonna see this. We're gonna observe this this deformity on the chest area of the client. Okay, hyperkyphosis. Okay, posterior curve on the mid back. Hyperlordosis is deep curve on the lower back, or scoliosis is a sideward curve on the mid back, okay, or the lumbar area, lower back may be present. In severe cases, the client may breathe through pursed lips. Okay, there may be signs of anxiety, cyanosis, discoloration of the cyanosis is the discoloration of the foot or the hands. Okay, bluish discoloration. It may be observed at the nail beds or the lips. Okay, so bluish discoloration of the skin in the hands or in the feet. Okay, the clubbing of the fingers, weight retention, and peripheral edema. Okay, the lower the limbs, the ends of the limbs swelling may be present in advanced cases. Okay, clubbing malformation of in the fingers. Okay, so next you're going to do palpation. The muscles of respiration and accessory muscles, including the diaphragm, intercostals, which is the in between the muscles in between the ribs. Okay, scalens is located on the neck area. Sternocleidomastoids located on the front of the neck and into the clavicle. Pectoralis major muscle, which is the largest muscle on the breast. Okay, pectoralis minor is also found on the breast area, and abdominals in our abdomen are tender and hypertonic. Okay, so hypertonic means it's tight. Okay, and the axillary attachments of pectoralis major and latissimus dorsi, as well as the costal margins, are frequently tender. So pectoralis major, it's on the breast area, and the latissimus dorsi is on the located on the lower part of the rib cage on the posterior back. Okay, so trigger points are likely present in the above muscles, and they may feel ropey and fibrosis, like thickening. Okay, there's adhesion in the area. So when there's adhesion or thickening, like ropey, like rope texture, trigger points, there's pain, it's tender, so trigger points will occur. Okay, in advanced cases, peripheral edema is palpated. Okay, peripheral, down the tip, down the ends. Okay, swelling is palpated. For testing, gonna do range of motion testing. The usual range of motion and strength testing protocol will be attempted. Okay, active free range of motion, it's when the client does the movement on the thoracic and cervical spine, thoracic on the rib cage area, cervical on the neck area, and the shoulder girdle reveals reduced ranges, especially in the thoracic spine. Okay, the rib cage area spine. The passive relaxed range of motion is when the therapist is helping or doing the movements, including static and motion. Palpation of the thoracic and cervical spine reveals areas of hypermobility. Hypermobility is like there's more the joint is more movable. Okay, hypermobile, especially in the thoracic spine, so it's very movable on the thoracic spine. Okay, active relax strength testing for muscles of the shoulder girdle. Okay, on the shoulder girdle by the upper back, on the shoulder area, and the abdominals in the abdomen area may be performed, assessing the possible weaknesses. Okay, so these are the testing you're gonna do. Okay, you have to do special tests as well. You're gonna do special tests as well, so you can do Vocal fremitus and mediate percussion test will be positive for areas of congestion due to mucus. Okay, this test help to locate the affected lobes for postural drainage. You just have, as a therapist, you just have to, or a student, you just have to research on vocal fremitus and mediate percussion special test. Okay, measurements of the thoracic circumference at full inhalation and full exhalation are taken using a tape measure and recorded. So inhalation and exhalation. Okay, measurement is at two levels: the axilla and the xiphoid process. The measurement of exhalation is subtracted from the measurement of inhalation to give the amount of thoracic expansion pertaining to the thorax, the ribcage area expansion. When you're breathing, you breathe in and out, you measure that and minus deduct with each other, and then you're gonna get the thoracic expansion. Normal differences in adults are between 3 to 7.5 centimeters. So these measurements, if you get these measurements, then these are normal. Okay. The rib motion test is positive when the client shows larger areas of restricted motion. Okay, while the rib palpation test and first rib mobility test reveal specific restricted ribs. The levator's costarum test is positive with rib fixation due to shortened levator's costarum muscles. Okay, and anterior and lateral spinous challenge reveal areas of hypomobility, like not so mobile joints. Okay, with hyperkyphosis. Okay, outward curvaceous on the posterior mid-back. Pectoralis major, muscle on the largest muscle on the breast area, and minor, this small muscle located on the breast area, are short. Okay, so when you do this special test, guys, you're gonna found these problems on these areas. Okay. Okay, for contraindications and precautions, so do not exhaust the client or tire the client with overtreatment or the prolonged application of painful techniques. Okay, this is a contraindication. You don't do this. Joint play techniques for the ribs and rib springing are contraindicated with rib hypermobility, okay, and a history of rib subluxation. Okay, so hypermobility, so it's over, very movable, okay, joints in the rib. Okay, so you don't do joint play in these areas. Okay, postural drainage is contraindicated with severe hemoptysis, copious amounts of blood in sputum. So hemoptysis or hemoptysis means copious amounts of blood in sputum. So there's a lot of, there's presence of blood in the sputum, in the mucus. Okay, severe pulmonary edema, pulmonary, like pertaining to the lungs swelling, congestive heart failure, pulmonary embolism. So there's clotting on the pertaining to the lung, the areas in the lung. Okay, the airway, the passageway towards the lungs. Severe hypertension, okay, and hypotension. So high blood pressure, severe high blood pressure and low blood pressure, hypotension. Recent myocardial infarction, which is the MI, and recent neurosurgery. Okay, so do not use postural drainage directly after the client has eaten. Okay, these are contraindications. Okay, tapotment is contraindicated over bony premises, floating ribs, and the breast tissue. The prolonged tapotment that accompanies postural drainage is contraindicated with chest wall pain, unstable angina, anticoagulation therapy, osteoporosis, rib fracture, prolonged steroid therapy, hemoptysis, untreated lung abscesses, pulmonary embolism, and open thoracic wounds or burns. Thyme essential oil is contraindicated with pregnant clients or those with hypertension. A client with cardiac or renal disorder should not increase the daily intake of water to thin mucus secretion. Okay? Chronic airflow obstruction may lead to pulmonary hypertension and is in occasional cases to right-sided heart failure. Treatment modifications are listed in the chapter or hypertension and congestive heart failure. Okay, just take note of this, guys. So let's move on to part 5, treatment plan. So we have goals here to follow, so just read on this, guys. For positioning, pillowing, and draping, just read on this, guys. For techniques, which involves hydrotherapy, okay, so the pre-treatment hydrotherapy such as facial steam for 5 minutes will help to thin the mucus. Okay, 5 drops of pure undiluted essential oil can be added to the bowl of hot water before the client covers the head and bowl with a towel. The client should close the eyes during the steam to avoid possible eye irritation by the oils. Okay, this is how you do facial steam. General treatment, just read on this, guys. Okay, we have specific treatment as well, so just read on this, guys. More specific treatments. Okay, so the treatment is ended with soothing effleurage and stroking to the back to decrease sympathetic nervous system firing your flight and fight response. Okay, so this is your treatment. Okay, now let's move on to part 6, self-care. So we have goals to follow as well. Just read on this, guys. For remedial exercises, we have listed a few here, so just read on these, guys. Okay, more remedial exercises. Okay, let's move on to treatment frequency. Treatment should be 45 minutes to an hour in length once a week while cough and dyspnea, shortness of breath are present. Okay, so expected outcomes. Outcome is variable depending on the presence of perpetuating factors and the length of time the disease has been present. Chronic bronchitis is likely to be an ongoing condition, which is a chronic thing, but massage can modify the symptoms. Okay, massage can reduce dyspnea, increase thoracic mobility, and facilitate mucus expectoration, so removing the mucus by coughing. Okay, the more severe the condition, the less of an impact treatment will have. Okay, so here you go, guys. This ends our video today. Okay, please like, comment, share, and subscribe my channel. Thanks for watching and have a great day.